Okay, so today we will continue with the endocrine disorders. Going back to the map, where we are going to review the disorders associated to a very special hormone secreted by the anterior pituitary and that acts directly on its target tissues that include almost any tissue in the body because most cells have receptors for the growth hormone. The growth hormone is also known as somatotropin, and as said before, many cells, like those of the connective tissue, cardiac and skeletal muscle, visceral organs, skin, or endocrine organs, have receptors for somatotropin. Among the effects it causes are the immediate increase in the rate of protein synthesis, use of fatty acids as energy source, while decreasing the use of glucose, which helps maintain blood glucose levels. So you can imagine by now that this hormone messes with in some way with insulin, and we will see how it does that. What is particular about the action of the growth hormone is that its tissue growth effect on bone and cartilage, body organs, or muscles are due to the production of insulin-like growth factors, or IGF, that are produced by the liver in response to the secretion of growth hormone by the anterior pituitary. Besides this purely growth effect, GH directly promotes lipolysis and stops glucose use, so its levels in blood increase rapidly, in which is known as anti-insulin effect of GH. So hypoglycemia found in fasting and starvation, as well as due to stress, trauma, or excitement, or heavy exercise, causes the release of growth hormone. On the other hand, hyperglycemia, free fatty acids, cortisol, and obesity inhibit the release of growth hormone. So if you think of a GH deficiency in children, given its effects, they will have short stature and obesity together with a delay in skeletal maturation, which give them an immature facial appearance. Regarding brain maturation, the GH deficiency was not associated with deficiency in specific mental abilities. Likewise, GH treatment in later childhood and adolescence did not seem to influence intelligence. Anyway, poverty is delayed in children and affects males, causing microphallus. If a newborn suffers GH deficiency, severe hypoglycemia followed by seizures may develop, and this is even more severe in the case of added ACTH deficiency. If GH deficiency appears later in childhood, it is normally due to the presence of a growing hypothalamic pituitary tumor. Whatever the cause, treatment is as simple as providing synthetic growth hormone as soon as it's detected. But sometimes GH deficiency progresses slowly in children or is developed during adulthood. One of the complications due to GH and the consequent IGF-1 deficiency is the increased thickness of the intima media of arteries. This reduces arterial distensibility and increases the prevalence of atherosclerotic plaques. Endothelial injury is also found in young and adults that have this type of deficiency. And the outcome is a higher cardiovascular mortality among these patients, especially if we have in mind some of the other consequences of the lack of GH, that include central adiposity, visceral fat, or insulin resistance and dyslipidemia. Normally there is a reserve of GH in a properly functioning pituitary gland, and this is exactly what needs to be measured in diagnosing this condition. So the gold standard is to induce an hypoglycemic state, injecting insulin to the patient and then measuring if GH is secreted to increase hypoglycemia. All right, that was for GH deficiency, but what happens if there is an hormone excess before puberty while the epiphyseal plate of long bone is still active? Well, this can be due to an adenoma of the cells that secrete somatotropin, and that excess of GH leads to an excess secretion of IGF-1 by the liver that will stimulate bone growth. Although today GH excess is soon detected and treated by destroying the pituitary adenoma, in the old times there was cases like the one you see in this picture of this extremely tall guy that probably could play basketball like golf. All right, so when the condition affects a patient whose epiphyseal plates are already fused, they develop what is called acromegaly. Up to 75% of these people have large, expansive tumors of the pituitary gland that erode the seia turcica and affects neighboring structures. So you know that the optic chiasm is very close to the pituitary, and it may be affected, so having side affection, right? Although they cannot grow taller, the liver in these patients it continues to deliver IGF-1, and that makes soft tissues to grow larger. So these patients will have big hands, feet, and nose, and the jaw, which continues to grow a bit in adulthood, will become protruding, and the teeth will get separated, affecting the bite. Cartilage continues to grow as well, so the larynx and the upper airways will be enlarged, causing a deep voice and a tendency to bronchitis. Although the bones cannot get longer, they can still become larger, and this will result in kyphosis with arthralgia and arthritis of the spine, the hips, and the knees. And the heart will also be larger, and atherosclerosis will develop fast, so these patients have a shorter life expectancy. This excess of GH and IGF-1 will cause many metabolic disturbances like increased free fatty acids and ketones formations to be used as fuel by the muscles and the adipose tissue instead of glucose. At the same time, the liver will increase its production of glucose. So as you see, all of this is just opposite to insulin, and the result is an hyperglycemia that leads to a release of insulin, trying to get the glucose levels to normal. In the long term, tissues may develop GH-induced insulin resistance, and the exhaustion of beta cells may result in diabetes. To diagnose these conditions, here is the opposite to the deficiency of GH. So the technique is to inject glucose to the patient and see if GH is suppressed. The following step is also to perform an CT scan, or also an MRI may work, to detect pituitary problems. And finally, here you have an image that shows the most common findings in patients with high levels of GH, specifically in adults. So thank you for listening. This is all for now.